And so a lot of these kids with autism are presenting with certainly neuropsychological symptoms, but also have sometimes hidden but sometimes evident GI symptoms that go unnoticed, maybe because whoever's seeing them isn't really trained in that or doesn't have that awareness of the connection between the two, or skin conditions like eczema, like you mentioned. Absolutely agree there. Now, you mentioned in the book, go ahead if you had something you were going to say.
Well, and there's some low-hanging fruit with a lot of children in general, autism or not autism. And if you are trying to find the sources of inflammatory stress, the two biggest low-hanging fruit is what are they eating and what is their gut like. So when someone comes in and I do assessment, I'm thinking in systems. I'm not just thinking about, their brain and their neurochemicals and their glutamatergic load versus how much GABA and serotonin they have. I'm also thinking about what's the balance of their gut. Do they have inflammation? Are they detoxing? Are they stooling every day? Are they sweating? Are they moving? What inflammatory things are mediating and propelling the symptoms? Like if they're allergic to eggs and they're eating them every day.
Right.
So food and gut are probably the two really foundational things to look at first. And pediatricians can do that. Families that don't see somebody functional can do that. Especially if your child has eczema. To me, eczema, 95% of my patients can be cured if you fix their food and if you fix their gut. And by fixing their food is really identifying, well, what are the foods that are causing inflammation? And there's two types of foods, as you know, and it gets kind of confusing for parents. And I've actually seen this a lot in clinic lately. Is we'll have somebody that has done a food study and they're like, oh no, I've already done that before. We don't need to get that blood work.